Hi everyone. As we observe World Cancer Day on 4th February, I want to share with you some knowledge or a field of dentistry which very few of us know, which is called as dental oncology. Many of us are not aware of the field, or I must say it's a specialty of dentistry which does not require us to have a special degree. It only requires us to be a dental graduate or a dental postgraduate, but we may have a better training or a better knowledge to handle cancer patients. So here I have Dr. Asif Ahmed, who is a dental oncologist at the Tata Medical Center at Kolkata. Now, the rest you must hear from him. Hello, sir, and welcome. Uh,
Yes, hello.
you have been in the field of dental oncology for quite some time.
Mhm.
So, please tell us about this specialty.
Yeah. So, dental oncology is a vast subject as per se. Uh, it deals with patients who have been treated with many or various types of cancers, but the main bulk of dental oncology comes from the head and neck and the plastic surgery team. So, we see around in our institution on Tata, we see around 30 to 40 patients per day in dental department itself, and majority of it comes from, as said earlier, from the head and neck and plastic surgeon team. So any dentist who deals with such onco patients can be known as dental oncologists, and they need to have some sort of experience and or some sort of skills to which will develop on their process of through the process. If they are as an observership or doing some sort of courses, there are various dental oncology fellowships that goes around in around the abroad itself. Probably not in India at this moment, but yes, in abroad they have multiple fellowships for dental oncology. So this is a branch that one can see after doing BDS or MDS.
So, what is the role of a dental oncologist?
The primary role of a dental oncologist is supporting the and maintaining the dental care of a patients who have already who are being treated with many various types of treatment, mainly the radiation, the pre-RT or post-RT evaluations and treatment and maintaining of the oral hygiene. Post-chemo, we have patients with many complications, even in BMT, pre-BMT evaluation that we do. The basic difference from a normal general dentistry and a dental oncologist comes in the part that we have to understand many medicines and various disorders that can happen due to various chemotherapeutic agents or various bisphosphonates as per se. We are not able to, we won't be able to do any sort of extractions, or multiple treatments or procedures are not applicable for various patients who have undergone bisphosphonates therapy or chemo or radiation as accordingly, because they have their own side effects. Head and neck team, they send the patient to us for a pre-op dental intervention if it's required to evaluate the number of teeth, mobile teeth, or any sort of caries teeth that is to be extracted. Myself being a prosthodontist, my role comes around in reconstruction part, right? So I help them doing the prosthetic reconstruction of various type of maxillofacial defects or head and neck defects, placing implants intraoperatively or post-operatively, doing some sort of anaplastic replacement of facial muscles, or replacement of or any sort of nose, eye, or ear, which are the patient loses due to the surgery as an surgical defect.
So, this field being little different from the normal dental practices, because there are many pros and cons of the treatments for cancer of the patient.
Correct.
So this field possesses certainly much more difficulty or challenges, isn't it?
It does. Challenges are there.
Okay. Is it more of a benefit for an oral surgeon or a prosthodontist to be in this field, considering there is the replacement part and also the surgical part?
See, dental oncology, I won't say it's only a job of a prosthodontist or a maxillary surgeon. It's a multidisciplinary approach. No one can do one treatment for a patient. There are multiple specialties required. You need to go for extraction. You might need a gingival therapy. You may need an ortho treatment. You may need a pediatric. For pediatric patients, periodontists are better to handle them than us. We are a geriatric. As per our training, we might mostly see the geriatric sort of patients. So it's a multidisciplinary approach. It's never a one man's job to do the dental oncology. So I won't say that. So I believe every field, every part of dentistry does need, or the dental oncology needs every part of the or every branch of dentistry to flourish in such. Like they should take up this opportunity. They should come to us or come forward and they should always go ahead with such prospects, because it is a multidisciplinary approach. Definitely, yes.
So how do you see the future as a dental oncologist? Do you see many more dentists in this field? Your views?
I believe so. I believe so. It will be the next thing to be. One should always see. Like initially there was the same happened with implants. When implants came, everyone was jumping into implants. There were implant courses all around the city and all around the places. Same will be on dental oncology. It's going to be the next big thing.
So as 4th February is the World Cancer Day, your message as a practitioner in this field?
My message is spread the word of dental oncology as a dental field, a dental oncologist and prosthodontist, I could say. And there are many patients who are request to, you all know the cons of, there is no pros for tobacco chewing, and because oral cancer is one of the most leading death for cancer, due to cancers in India and in the subcontinent. So there is no pros for tobacco usage. So I would request each and everyone who does consume tobacco in any form should leave it as early as possible. And for dental friends and fraternity, don't extract mobile teeth for the sake of mobility. Don't leave any sharp teeth. Don't go for any don't leave any loose dentures. Don't leave any loose spaces, because these are the things which are very minute. And I have seen cases with minute changes like this, because of sharp teeth, can lead to a deadly cancers, and it increases the morbidity of the patient. If there's just a filing or the enameloplasty of the tooth, could have helped the patient initial stages, or just extracting a mobile tooth for the sake of it's just a periodontal disease. There might be an gross underlying disease lying beneath that mobile tooth. So one should always be confirmed prior to extracting any tooth.
Most certainly, sir. As I was just going through the data, that in 2021, oral cancer was about 11% of all the cancers in India, and India has the 1/3 of world's number of oral cancer patients. Yes. So most certainly, whenever actually in dental clinics, clinicians have a mindset to jump into it has become the trend to jump into the operative procedure more than taking the medical history. we just look into the dental problem as the chief complaint and we start treating the chief complaint. So isn't it a message for the dentist that we shouldn't extract whenever we see any mobility? We should take the we should rather concentrate on the systemic health also of the patient.
That's true. That's true. Because I have seen patients, like they go to a dental surgeon with some tooth pain or a mobile tooth, and the patient gets their tooth extracted. Even a patient with a breast cancer or a prostate cancer might be undergoing some sort of bisphosphonate therapy. So if you just overlook that and did not take that history, or if you are unknown to that medications, then you might lead to something called as bronch. There is an osteonecrosis of the jaw. So just as extraction could lead, the patient might lose his jaw for or his or her jaw for that. So you have to take that medical history, and you should also have a sound knowledge regarding at least the basic knowledge around which medicines are indicated for extraction and which are not.
Okay. Thank you so much for sharing your knowledge. Thank you.
Thank you, Dr.
Thank you for watching this video and do share the video if you find it useful. I'll come back next time with something equally informative or useful. Thank you.